Tibor, thank you so much for joining us this morning. We speak to medical professionals about COVID-19 almost every day for the last few months. And it seems what we know about COVID-19 seems to change every so often. The basics remain the same. You'd understand then that there was some raising of eyebrows when these regulations were released, and perhaps people reacted with some fearfulness that colleagues that perhaps test positive for COVID-19 do not need to come up with a negative test before they return to the workplace. Can you explain to us the thoughts behind these regulations that were announced?
Good morning, and thank you for the opportunity. The virus as it stands, and you quite correctly stated so, at this moment in time, and we are talking about several months after the virus became known to us, that this virus has run a particular course, and the science behind it seems to be quite clear that after a number of days, and in this case we have taken up 14 days to be the case, that after 14 days a worker that no longer shows symptoms can return back to work. Now, I need to put a proviso to that, because if a worker has been moderately to severely ill, that worker would need to still go to a medical practitioner, and that medical practitioner would need to indicate whether or not the worker is fit to return to work. We know that after a certain period, to repeat myself, that the virus will run its course in most instances. If not, you would most likely become a lot more severely ill. We know that over the last several months, that the virus has infected a small percentage, if I can use that term, of people, and in a very small percentage of that do people unfortunately pass away. But the majority of people are being infected, and they do recover after a certain period of time. Of course, we don't know who's going to become severely ill and so on, and that is the same case with all the other diseases such as influenza and so on. It does run a certain course. Now, in this case, when we were drafting this, we had people from the medical fraternity that formed part of the NEDLAC process that was putting this particular piece of legislation together. And in that case, it was deemed, the 14 days was deemed to be sufficient to see that most people would have recovered after that period. This is the same with most illnesses. Some of us are going to get better. Unfortunately, some of us will get a bit more ill, and in the smaller percentage, it might affect others a lot more differently. Those who are suffering from other types of diseases could be affected more severely. But all in all, anything up to after 14 days, you should have recovered. On your return to work, of course, if you do return to work, there's an expectation on the employer to monitor that you are progressing well and that you're not regressing, and that you do follow the what we call the best practices in terms of sanitizing your hands, wearing a mask, washing your hands when required, disinfecting your workplaces and so on. And I think at this stage, we have learned over time, not just now, but we know that there are certain practices when there is a disease that's prevalent.
Unfortunately, we seem to have lost our connection to Tibor Szana. He is the Labour Department's Chief Inspector for Health and Safety.